James?
I really have two questions, more general political strategy. Given what you said, which is absolutely true, you know, the Democrats have a filibuster-proof majority, they've got the White House, they've got the House by a significant number, and they're using everything they have on their side to roll stuff through. We're fortunate to live in a state that still, you know, believes in individual liberty, and we've got a good governor and a couple of good senators. But because of that, you know, we can't call a senator who's waffling and you know, get them on the right side on healthcare, right? And so what can we do? You know, especially when we hear news reports about, you know, Democrat senators whose calls are coming in 9-1 against, and they vote for it anyway, right? What can be done on a practical basis to somehow stem this when they've got all the cards?
Well, let me just take one premise, and I won't do anything political right here, but I do not agree that we have kept taxes low in Texas. And I want you to understand that I will disagree with you on that point.
Sure.
The business franchise tax and property taxes in this state are out of hand.
Okay.
So I'm just going to argue with that premise, but that's not why you're here.
Yeah.
You in another
speaking, the national
on
issue
another
is more
forum.
concerning. Yeah.
But this is all we can do, and it's one of the reasons that we are very frustrated. All we can do is educate. All we can do is talk. That is why I've written 2 op-eds. It's why I've spoken on the Senate floor. It's why all of us are doing this. We're on I was on Wolf Blitzer yesterday after I had a press conference at Parkland Hospital talking about the incredible idea that you would pay for this government takeover by cutting your hospitals in urban and rural areas. So we feel that our best contribution is to speak out and speak out in every form. And we are, that's why they had to move this vote from August, their self-imposed deadline. And so we are doing everything we can to slow it down so that the more people hear about it, they know how bad it would be. Like the Congressional Budget Office, that has always been very nonpartisan, bipartisan, really a think tank. And when they came out and said, this isn't going to cut the cost of health care, it's going to increase the cost of health care, they said that right out. Then last week when I was able to question Chairman Bernanke, I said, don't you think this is going to have an impact on our economy when the Congressional Budget Office says that this is going to increase costs at a time when we're trying to increase jobs, we're trying to get our economy going, and this is a big government takeover? And he basically waffled but said, yes, it bothers me. I mean, that was kind of the end result, but that is what we're trying to do. Can we affect the Democrats who are now waffling? Yes, I think the fact that we have spoken out so much and delayed so much so that more and more comes out about the consequences, I think is a very important part of our contribution. And I do think that everything that we can do to influence the Democrats, that's where this is going to be decided. It's going to be the Evan Bayes and the Bill Nelsons and the Ben Nelsons, the Arkansas senators. They come from states where there are more centrist Democrats, and there are others that are very concerned about this. And I think the more we can get associations that we maybe are a part of to speak out. Just as an example, the American Hospital Association endorsed this plan.
Yeah.
So did the doctors, the American Medical Association.
The AMA hasn't represented the doctors for decades.
decades and decades. They do not represent the doctors.
AARP ones too.
Yeah, well, you'd expect that.
So what we need to do is to have national organizations go through their state members to stop this. Now, the Texas Hospital Association isn't signing on to the American Hospital Association position. Neither is the TMA, Texas Medical Association. So we're, one of the reasons I wrote the op-ed piece on the hospitals was to differentiate Texas hospitals and shore up their opposition. Because it is not representing their members to allow cuts in rural hospitals. Oh my gosh, they barely survive now. And our teaching hospitals, they can't make ends meet if they are going to be cut from, it's called DishPro, is what it's called, the added amount that these hospitals that are teaching hospitals and hospitals that serve indigents get from Medicare and Medicaid. It's called a DishPro share, and that is what keeps them going for all of the free services that they give. And that's what they're going to cut to pay for this plan.